the study that's being was presented at EHA is about patients with either relapsed refractory myelodysplasia or high-risk untreated myelodysplasia, and it's using a novel drug, using a cleaver-1 antibody, which is a novel macrophage immune checkpoint inhibitor, together with azacitidine. Basically, the cleaver-1 antibody converts, the mechanism of action is it converts anti-tumorogenic macrophages to pro-inflammatory and activates a T cell response. And it also may have an effect on blast cell energy production, as it has an effect on oxidative phosphorylation. It essentially has a triple mechanism of action. The study design was basically, again, two cohorts of patients, one with frontline MDS and one with that had high or very high risk disease. And the second group of patients were patients with relapse refractory myelodysplasia, and they all had failed a prior hypermethylating agent. The design was basically a phase 1, phase 2 design. Once the optimum dose of Bexmarilimab was found, it then moved to the phase 2 part of the study, where 2 doses of Bexmarilimab was tested, either the 6 milligram per kilo dose or the 3 milligram per kilo dose. So in frontline high-risk MDS patients, there were 21 patients treated. So if you classify them by the latest 2023 IWG classification, the overall response rate was 55%, and the CCR rate was 50%. Of these patients, 20% had a complete response, 15% CREQ, and 15% CRL. 45% of patients did not respond to the treatment. For the patients with relapsed refractory MDS, again, by the latest IWG 2023 classification, the overall response rate was 47%, and complete CR rate was 16%. The median overall survival for the relapsed refractory group of patients was estimate is about 13.4 months, and it's the 95% confidence interval is 4.8 months to being not reached. So far, for myelodysplasia patients failing hypermethylating agents, there is no effective therapy. And the study showed a 63% overall response rate by IWG 2006 in this group of patients. In the frontline setting for intermediate and high-risk patients, by the 2006 criteria, there was an 85% overall response rate. And based on these encouraging data, a phase 3 randomized study is being planned comparing azacitidine, which is the standard of therapy, to azacitidine plus Bexmarilimab. Bexmarilimab was well tolerated in this group of patients. The safety data remains favorable. 13% of patients discontinued treatment due to treatment emergent adverse events. Only one patient discontinued Bexmarilimab due to encephalopathy. There were 3 grade 5 treatment emergent events, but none of these were attributed to Bexmarilimab. The most common Bexmarilimab related AEs were white cell count decreased in 11.3% of patients, fatigue in 7.6% of patients, and neutrophil count decreased in 7.6% of patients. So overall, the drug is very well tolerated and is given on a week, and the Bexmarilimab is given on a weekly basis.